We had a chance to sit down with skincare expert Jan Marini and find out about the latest products in the Jan Marini Skin Research line. And since New Beauty readers have named her skincare system as one of the best, we decided to give you the opportunity to ask her your skincare questions via our Facebook page and Twitter. So here are her answers.
This is not an uncommon issue among adult women because acne today is an epidemic among women in their 20s, 30s, 40s, and beyond. And the term acne is a term that describes a process. So even if you just have an occasional breakout, or you have a whitehead, or you have some clogged follicles, it's all acne. It's either mild acne, transient acne, or more severe acne. And in the past, women have had to choose between, do you want to treat aging and possibly exacerbate your acne, or do you want to treat acne and cause the skin to dry out and maybe peel and be a little bit more red? Today there's a product called Duality, and Duality is a marriage of two ingredients that have medical validation, that are gold standard in the medical community, that have never been able to be used before in the same product. And one is a powerful acne medication, and the other one is an anti-aging medication that also works on acne at the same time. And when you put these two ingredients together, they absolutely are phenomenal for adult acne as well as de-aging the skin. Well, there are two types of fine lines and wrinkles. Now the good news is that the majority of them are caused by cumulative sun exposure. And those are fine lines and wrinkles that typically respond to topical agents and also to cosmetic procedures, lasers, things like that. The second is what we call dynamic muscle movement. And even if you lived in a cave and didn't have sun exposure, dynamic muscle movement can cause creases. And those are the creases we get in the forehead, the creases that we get by the corners of our eyes that we refer to as crow's feet. Dynamic muscle movement typically doesn't respond well to topical agents. You can soften them, but that's where your neuromodulators come in, like Botox, Dysport, those kinds of things. And I'm not suggesting that everybody should use those, but realistically, those work to relax the muscle, and when the muscle relaxes, the crease that's caused in the skin virtually goes away over time. Droopy eyelids occur for a couple of reasons. First of all, some people have redundant fat. And as that fat begins to herniate in the upper eyelid, then the eyelids tend to droop more. But another reason for eyelids to droop is when the forehead starts to move down. And as the forehead starts to move down and the brow moves down, then the eyelid looks more droopy. So it's important to determine which is causing that to occur. If it's the forehead moving down, certainly a forehead lift would be one option, but another option is that many of the neuromodulators, Botox, Dysport, etc., actually can be used in certain areas to cause those muscles to pull back up. And so the eye area doesn't look as droopy. It's been such a pleasure answering your questions. Thank you so much.